It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, thanks for joining us. I'm Sam Lesante. Folks, this show is going to be great because I have the chance of having a good discussion with a friend of mine who's my brother, adopted brother. I've known him for many years and we've become very close. He's a great person. He has a show here on SSP TV. We worked together for many years, and let me tell you something, my friends. This is a guy, a man of his word. Of all the things we've ever done with our business, there's never once that we ever had to sign a contract that was a handshake. So you're talking about trust, trusting a person. This guy is fantastic. I'm talking about my good friend, Dr. Thomas Meade. He was just awarded again for the 5th time the best surgeon. I thought it'd be a great opportunity to bring him on the show just to review some of the things he's done. Thomas, how are you?
Sam, I'm great. Thanks again for having me on the show. But before we get started, I have something for you.
I hope it's money.
It's not money. It's not money. But anyway, I have an autographed copy of a book that we just published.
Oh, okay.
So my chief resident and I at Jefferson published a book. Steve is really the inventor of the Kinematic knee replacement, which is really the type of knee replacement that we do. It's a personalized knee replacement where we reproduce the patient's normal anatomy. So most knee replacements for the past 50 years are cookie cutter approach. Everybody gets the same exact type of knee. But Dr. Howell developed this in 2006, and he and I have done more than anybody in the country. So Steve has produced a series of videos that we converted into a book called The 10 Commandments of Calipered Kinematic Aligned Total Knee Arthroplasty. Long title, mostly for orthopedic surgeons and residents to learn the technique. But it's also for the discriminating patient that really, if they want to know what type of knee replacement we do and why it's different than that's done elsewhere in the country. So for that, I gave you your own autographed copy. I want you to have it.
Thank you.
And if you want to buy more, it's available on Amazon.
Yeah, I was just going to say. So if I go to Amazon, this is fantastic, and look for the 10 Commandments of, what's that?
Calipered Kinematic Aligned Total Knee Arthroplasty.
Boy, that's hard. And you get the book, Amazon.
The book.
I'm going to look at this, and we'll talk a little bit more about this.
Okay.
But you know, this, I'm not surprised. You know, you write a book. You know, one of the top surgeons in the country. It's amazing. So let me ask you this, okay? I know you so a long time, your family, your great things. What inspired you to get in medicine?
So, you know, it's a good question. When I was a kid, my parents weren't physicians, you know, like a lot of folks. I went to medical school, but really a couple things. When I grew up, we had a great team physician at Pittston High School. My parents were very proud of the physicians in Pittston, so I saw the respect they had for their physicians. So that was sort of the initial entree for me to be interested in medicine. But I was kind of good in science and math, and when I went to college, I really wasn't sure what I was going to do. What do you do if you're interested in science and math? So I was actually toying between becoming an engineer or going into medicine, 2 different spectrums. And I think what pushed me over, besides, you know, my parents' appreciation of our town physicians, was when I was injured in college and dislocated my shoulder, ultimately needed surgery by an orthopedic surgeon in Scranton, and it was Dr. Joe Caesar. And when I went through that process, I said, this is it. I want to go into medicine, and I want to be an orthopedic surgeon.
And that was it.
That was it.
Now your father was a state cop.
True.
So why didn't you follow him?
Well, I think you know, my dad loved that. He was in the service, and he was in the he was in the police force. But even my dad, I think, as he got on in age, you know, he had a big family and a mortgage and house, and you have the American dream you have to support. And I think even in retrospect, he loved what he did, but he perhaps would have went on to higher education and aspired to be a lawyer. And I look at him and I said, well, you know, I didn't want to be a lawyer, but what do I aspire to be? And I think in my skill set, I was kind of good in science and math, and I said I liked medicine, so it was just a natural path for me to follow.
Well, you said medicine, so I mean, did you go in wanting to be an orthopedic surgeon?
So I went in my early years at medical school. You have to decide between two divisions, two specialties, really medicine or surgery. So I took the surgical tract. So I didn't really know if I was going to go into orthopedics. Now, I had a penchant for orthopedics because of my injury and my association with Dr. Caesar and Scranton. But I did a lot of vascular surgery. I did a lot of transplant surgery early on. So really, my surgical tract was then divided on two different roads. I was going to go into vascular transplant surgery or orthopedics. And so before I finished with my 4 years of medical school, I made a final decision to go into orthopedics, and I never looked back.
It fascinates me when people go into different fields, and especially particularly in medicine. So then you become a specialist in different areas. How did you then, I mean, you're one of the top orthopedic surgeons in the country, not in Pennsylvania, but in the country. What did you do, or how did that make you? Is it more studying? Is it more exploratory? Is it like, what puts you in that category of being as good as you are?
So I guess it's like any other industry. When I finished my orthopedic residency, you could stop and you could go out and practice orthopedic surgery. But I looked at what our training was good at Jefferson and where were the deficits. We were so strong in joint replacements. We were very strong in spine surgery. We were strong in trauma. But at that time, we were weak in sports. And I had an athletic background and I liked sports. And I was injured in sports and was operated on for a sports injury. So I said, I need more training if I'm going to go out there and provide a good service to people. And so I looked around the country for some of the top fellowship programs in sports. And I decided on Cincinnati. Frank Noyes is one of the preeminent researchers in sports medicine. So I spent an extra year of training and doing research, specifically in sports medicine and advanced knee reconstruction. And then ironically, Dr. Noyes asked me to stay on in Cincinnati and write a book with him. And by that time, I think my wife was a little tired of school and said, we have to get a real job. I was in my 30s. And by that time, I had a lot of training, and I came back to the Lehigh Valley, and I started my practice and specialized in sports medicine and with a subspecialty in trauma because it was a level 1 trauma center. So I did a lot of trauma surgery, a lot of sports surgery. So I think my training has sort of made me good in one point, but until you get out there and you do thousands of operations, you're not going to be good. Nothing makes you better than trauma surgery. In the middle of the night, a motorcyclist comes in, all 4 limbs are broken and open wounds, and you have to be able to diagnose it, triage it, organize it, and attack one injury after another. So I think nothing made me better in orthopedics than trauma surgery, along with my fellowship.
Going back to 2006, when I was first introduced to you and we started doing shows with you, and looking at the time from 2006 to the present, I've seen so many innovative things that you've done and got involved with people who manufacture the knees and the whole bit, okay? And you're always inspired to, you're not like, okay, like you said, I'll be an orthopedic surgeon, I do what I have to do and that's it. But you're always learning something, okay? What gives you that go? I mean, it's like you're always, the drive, yeah. You're always doing something.
Because I think, for those that are given much, much is expected. And so I think I've been given a lot of opportunities. I've been given a certain set of skills. And I could divide my answer into several components. But when I got to the Lehigh Valley, what they were lacking is what they had in Cincinnati. They had a sophisticated sports system for all the high schools and colleges. So they really didn't have a sports medicine program to help the kids. So that's one of the first things that I wanted to develop, which we did. In all the high schools in the Allentown area, we put in team physicians, athletic trainers. We brought college-trained sophistication to the sidelines. So that was kind of a cool thing to do. And then we went on to the next step in medical fitness. There were a lot of gyms out there, but no such thing as medical fitness. We brought medical fitness to the Lehigh Valley. And then I wanted to expand up north. So when I met you in 2006, we were just building a state-of-the-art 300,000 square foot facility in Allentown. And a lot of my colleagues were happy with that. But I said, we built it here, but let's move up north into, you know, the Hazleton, Lehighton, Pittston area that didn't have that. So it was just sort of this drive to share what we did well, what we experienced excellent in those fields, and sort of parlay it into our home area up north. So it's just this constant drive for improvement and sharing the wealth, if you will, sharing the expertise that we have and expanding it into other parts of northeastern Pennsylvania.
You know, as a surgeon that you are, and you know, hitting the television like you did for many years, you're a marketer. You know, every surgery you do, you know, let's assume you did 1,000. You have one or two of them that, you know, people are not happy, okay? And we're talking about one or two. I'm not talking about 30 or 40. And it's like sometimes, like any doctor, they certainly try to do their best in doing what they do. But sometimes, you know, the best doesn't work out because either the patient does not follow the instructions of what the doctor said, and of course the doctor gets criticized for that, okay? Well, how have you been able to, you know, and it's just an infinitesimal amount of people that maybe did not, you know, get the satisfaction from your surgery? What do you...
Sam, it's a great question. It's really not 1 or 2%. If you look at patient-reported outcomes across the country in hundreds of thousands, millions of orthopedic cases, the dissatisfaction rate is about 20%.
Wow.
Yeah, 20, they're dissatisfied.
Wow.
It doesn't mean they're not better than they were before,
Wow.
but their expectations, you know, aren't met. So it's always that drive, like our Kinematic book. Total knee replacements across the world have a 20% dissatisfaction rate. So I credit Dr. Steve Howell for saying, what can we do better? And sort of that was our goal with kinematic knee replacement, try to increase the satisfaction level. But to your point, it's the hardest part of our job. There's no perfection in surgery. There's no perfection. And so how you deal with complications is very important. It's easy to deal with people that have a perfect result. They're happy. But the other people, we live with it. You can't sleep, you agonize over it, but it's really this constant struggle for improvement, understanding why things go wrong, being empathetic, talking to the patient, educating them, communicating them, and getting them through it. But that's the hardest part of my job.
See, sometimes they think that the physicians are not human beings, you know, that you just said something. I can't imagine how many times, you know, you have left surgery and, you know, maybe talk to the patient, it wasn't going the way you wanted to go, that you bring that home with you. Okay? I think they just think that you just close the door and that's it. No, knowing you live with that.
Well, it's hard, you live with it. The patient's emotional, but we're emotional too. I mean, you live with every result that isn't perfect. But you know what's interesting with the pandemic and this vaccination? When people say, well, you know, why is my neighbor doing so good and I'm not? And I said, well, you know, look at the vaccinations. It's a great example of a human experiment. Everybody gets the same exact vaccination. So you and your neighbor go, you get the same one, and you go, I didn't notice anything. My arm wasn't even sore. And your neighbor goes, I couldn't come out for a week. I felt like it kicked me in the back. It felt like I had the flu. And why is that? Because we're all different genetic creatures. We all have a different genetic blueprint. We've lived different lives. We have different lifestyles. And so just as the same vaccine will react different in different people because we have different immune systems, the same exact operation done on two different people will have two different results because they have two different bodies, two different genetic blueprints. They have two different lifestyles, two different anatomic blueprints. Everything is different. So it's not that hard to understand why two people get two different results from the same operation.
Folks, I'm talking to Dr. Thomas Meade. He's like my brother, folks. He's been around for a long time. has his show here, 2 shows, Real Life in the OR and the Dr. Meade Show. We'll be back right after this. Welcome back to the Sam Lesante Show, folks, 24/7. For you people who are watching us on Comcast 190, we're on 7 to 11 on the greater Pottsville area, Comcast 190. Channel 92, the Wilkes-Barre system, from 7 to 11 p.m. every Saturday and Sunday evening, and of course SSP TV 13 and 513 on Service Electric Cablevision 24/7. My guest today is Dr. Thomas Meade. Like my brother, folks. I've known him for many, many years, and he just wrote a book. Just gave me the book today, and the book is The 10 Commandments of
Calipered Kinematic Knee Arthroplasty.
Yeah, it's too big for me to say. You can get it on Amazon. And what does this book tell you?
So it's really the technique of our knee replacement. My co-author, Steve Howell, invented this, but kinematics, most people have heard the word kinematics or kinesiology. Some kids go to college and they study kinesiology. It's the study of the movement of the body. And so when we do a knee replacement, we're trying to replace the normal kinematics of the knee, how a normal knee moves. The way we were taught how to do knee replacement 30 years ago did not reproduce the normal kinematics of the knee. It was a cookie cutter approach where everybody got the same knee. Well, your knee is different than mine, Sam. We may have a different angle, we may have different angles of our tibia and our fibula and how it moves. And so if we were going to do a knee replacement on you, we'd want to replace your anatomy. We don't want to put my anatomy on yours. So this book explains basically to the orthopedic surgeon, but any patient that wants to know exactly what we do, here is the whole technique.
Shows everything.
Of a kinematic knee replacement.
Yeah, it shows everything, all the procedure and everything.
And my co-author, Dr. Stephen Howell, invented this.
Wow.
So
and you use this knee.
And we both trained at Jefferson, so we published this book, and it's for teaching purposes for residents, but it's also for patients. Available on Amazon.
What is the best part of your job?
Best part of my job is talking to patients, just like you. It's interesting, when I was in the office today, and when we're in there, we were taught to do this dry history and physical exam. What happened? Where does it hurt? How long has it hurt? How severe is it? Where does it radiate? Up and down. And that's how we're taught. And so, that was when you're in medical school. You had to go through that. But the best part of my job is talking to patients and saying, Sam, you come in here with your knee. What do you do? Well, I'm executive of a TV station. Well, what do you do? Do you see? I sit all day. When you get up, is it stiff? Yeah. How about at home? I have grandchildren. I can't get down and play with them. I've been noticing this since Christmas, and I was a musician early in my life, so I carried a lot of instruments, and you get a picture. And so the fun part of my job is painting the picture of Sam Lesante and putting it in perspective to the symptoms that they have. And through that, I will extract, how does your knee hurt? How long does it hurt? Where does it hurt? And you get the same answers, but you'll remember it because there's a story behind it. And so it's a privilege for me to be invited into your personal story and then apply the orthopedic principles. So that's the best part of my job.
The interesting thing there is this. When you're talking to someone, whether they're sincere and whether they're just phony or they're listening, okay? With you, you get the true picture. Not because I love you as a brother, that. But the point is that when you are talking to someone and they're telling you that story means something to you. It's not just something I got to do. All right, let me tell it 4 minutes. It's a story that means something to you, and that translates to that person either the better healing process or just believing that the person who was replaced their knee is concerned about them, and I think that's what I hear about about Dr. Meade. Oh, he's such a nice guy. He's he listens to you, etc. And you mean that.
Well, you don't want a patient to leave and think you were just a white-coated doctor. You want them to think that was not like any other doctor appointment I ever went to. You know, you want to walk out and think you're a real person, because that's a real person I'm talking to. So you want to let them know you're a real person. And I think that's the fun part of my job. And it helps me remember patients. I don't have to look at the records when that patient comes back again. And I know
the story.
And I know the story.
Yeah. Now, I asked you about the best part. What's the hardest part of your job?
Well, I think we talked about that. The hardest part of my job is dealing with the complications and the imperfections that occur. Right. Yeah. And I think that's, you know, and that's the hardest part. But you do have to compartmentalize that. And, you know, you can't, a mistake a lot of physicians make is, like I said, if 20% of the patients, and hopefully that's a lot less in our practice, don't meet the expectations, you have to sort of figure out why. And the more you communicate that up front, the less likely you are to have adverse outcomes. So dealing with unexpected outcomes is probably the hardest part of my job.
What do you imagine the future will bring for the patient care?
So the future of orthopedics is exciting, but we see it now. The whole, you know, 95% of all the knee replacements I do go home the same morning. That was unheard of 30 years ago. So I think the future of orthopedics is essentially all outpatient care other than catastrophic injuries, very sick people, trauma patients. Orthobiologics will continue to evolve, and that's things like stem cells and PRP, and get away from the scam artist out there now running these. But in the future, I think orthobiologics in the younger knees will have a bigger outcome, and robotics are not going away. So robotics have inundated other specialties like urology and general surgery, and now they're coming into orthopedics. They've been out there for 10 years. I've been dabbling in robotics, but I think they're finally here where they will have a major role in the near future.
Now, when we were doing Real Life in the OR, okay, in the beginning, I was coming down with Sammy, and you were, you know, you had maybe 6 or 8, 10 a day. Now, some people feel, my God, you're going in there, you know, you're really knocking them off one at a time. Are you paying attention? Are they getting their care they can? Some other orthopedic doctors, it takes 2-3 hours, and Meade gets in there, and with a half an hour, 45, he's out, etc. How do you account for that?
So it's not Meade, we call them centers of excellence. So if you look at the data helps you analyze anything. So in orthopedics, the longer you are in the operating room, the higher your complication rate. So there's a cutoff where around the country there are very few excellent joint surgeons that take more than an hour to do a knee replacement. If you're going more than an hour on average, you're taking too many steps, you're repeating steps. Dr. Rothman, who I trained under, said you should never repeat steps, know all your steps. Everybody should be like an orchestra. You go through the process. When people take 2 or 3 hours, they don't know the steps. They're thinking at each step, they haven't thought out the procedure. It's like a checklist on an airplane. So you want to go through them. You don't want to rush, but you don't want to take too long. Anything that goes over an hour and a half, your infection rate goes up, your complication rate goes up, your chance of bleeding goes up. So the statistics are there. So you want to be right in that sweet spot, that bell-shaped curve. And you have a team. We're fortunate to have a team. If you go in the OR and get a different team each time, your efficiency doubles. So it's all in the planning. So it's, you know, I think you can have people that are a little envious of a good hospital, a good network, and a good team. But if it's done well, you could, you know, go to the centers of excellence, HSS, you go Lehigh Valley, you go to Rothman, and the best places are doing the highest volume. The highest volume has the lowest complications. Hands down, Sam.
Thomas Meade, folks, Dr. Thomas Meade. Look at the show, Dr. Meade, on YouTube. I hate to tell you this, my friends, but on our website, his show goes through the roof. You know, when you Google Real Life in the OR, the Dr. Meade show, he even beats the Sam Lesante show. I'm going to get even with you on that. We'll be back right after this. Welcome back to the Sam Lesante Show, ssptv.com. 21 local neighborhood programs we produce, my friends. Check it out. My guest today, a good friend of mine for many, many years, like my brother, Dr. Thomas Meade. Thomas wrote a book, and I'm going to let him tell you what the book is. What's the name of the book?
It's the 10 Commandments of Calipered, Kinematic, Aligned, Total, and the Arthroplasty. It's a big word for how we do knee replacements for patients and residents in learning.
You're going to get a knee replacement? Get the book, Amazon.com. All right, in closing, what is one of the most rewarding things you've done?
The TV shows. The 2 TV shows, Sam, that you introduced me to. And the reason I say that is I'll put that in the category of education. So we do the TV shows you introduced me to, and it's a way of educating tens of thousands of people. So we would do seminars all the time, and if we're lucky, we'd get 100 people at a seminar, and you showed me the value of amplification or magnification of that. So, oh, excuse me, that's the hospital.
Yeah.
Let me answer
I
that.
hope it's not a serious call,
Let me
folks.
hospital.
Now listen, I want you to know, I did not tell him to say that.
Oh, they said
They
they said
did.
they'll call back.
They'll call back.
So, but no, it's all about education. So the most rewarding part is education. Whether I'm doing seminars in person, whether I'm doing Zoom, or whether I'm doing your shows.
Yeah, and I couldn't agree with you more. I know I'm in the business, and when you say this, but we have a show called Law Talk with with Attorney Slusser,
Yes.
and we had different lawyers come on, and believe me, they've learned so much from these shows. And of course, we have attorneys who come on, but all the attorneys that bring this information, it's education, education, education. Thomas, it's so nice to have you on the show.
Sam, it's always a pleasure to be here. I really, really appreciate it. Our friendship means so much to me, and over the years, this has been such a valuable asset to my personal life and professional life.
I don't have to tell you how much you mean to our family. I've told you that many times, folks. Thomas Meade, watch the show, Dr. Thomas Meade Show, and Real Life in the OR. And if you need some knee surgery, etc., and do not hesitate, my friends. I have a friend of mine who is in pain all the time. I'll wait till it gets really bad. That's the worst thing I like to hear. Don't wait till it gets really bad. Just get it checked. Nice seeing you. We'll see you next time.